flat top lesion with diameter. It is having diameter greater than height. Height is very less, but diameter is a long lesions. Okay. Wheel, transient swelling of the skin. I will show the photos and you can identify. Vesicle, blister less than 5 mm. Okay. And when it is greater than 5 mm, it is called bulla. Pustule, pus is there. Sometimes it will be white or yellow or green pustule. Erosion, epidermis alone has been lost. So epidermis is lost. It is called erosion. Ulcer, epidermis and part of dermis. That's the difference between erosion and ulcer. Erosion, epidermis is lost. Ulcer, epidermis and dermis is lost. Fissure, a cut. Okay, it is called fissure. And telangiectasia, dermal blood vessels will be seen. It is called telangiectasia. I think you have seen all these things. Comedon, keratin and sebum lodging in pilosebaceous orifice. It is called comedon. Scale, high flake of keratinized epidermal cells lying on the skin surface itself. Okay, I will show the photos. Okay, I'm just explaining it on the basis of this. Crust, dry, serous or sanguineous exudate. Clear? I will give the PPT. Hyperkeratosis that we have discussed. Thickened stratum cornea. Okay. Atrophy, thinning of the skin. Okay. Why? Because tissue layers will be lost. That's why. Sclerosis, hardening of the skin. Full hardening. This is called sclerosis. Lichenification, thickened skin with increased markings will be there. Umbilicated like umbilicus. Okay. Exudate, blood vessels with high content of protein and all these things. Wart, horny excrescence. It is called wart. Excoriation, scratch. When during accident you are getting, okay, excoriation or scratch. Clear? I will show the photos. Acne you are knowing, isn't it? Second one, this is called bullae. Keloid, I think you want to identify all these lesions. Are you able to identify? Yes or no? After this class, you want to identify, that's all. I think I've seen this, but you want to write like that. Okay, from tomorrow onwards, your diagnosis should be on the basis of this thing. An acne scene, a bullae scene, a keloid scene, okay, a macule scene, lichen, you can see, lichenification. Diameter height is less, but diameter is large, isn't it? Papule, you can see papule, small. Okay, plaque, clear? This is urticaria. Someone is going and we can see like it is called urticaria. Vesicle, fluid filled. It is called vesicle. Okay. This is wheel. Clear? You can see again. Bullae. So collection of free fluid greater than 1 centimeter is called bullae. Macule. Circular flat discoloration. It is called macule. It is not a swelling or like that. It is a flat discoloration. Nodule. Circular elevated solid lesion. Okay. Patch. Circumscribed flat discoloration. I will ask in the cases itself. Papule. Okay. You're getting plaque, pustule, vesicle. You're getting, you want to identify between macule, pustule, and vesicle. All these three are seen in which condition? Macule, papule, pustule, and vesicle can be seen in which condition? Anyone? Together. Chickenpox, yes. Correct answer. Chickenpox. Urticaria. Urticaria, you can see something, urticaria is happening due to the allergic reaction. So something, if you are getting something, some with allergy or something, you are exposed to some insects. That insect is moving and your skin is elevated on that area only. It is called urticaria. Wheel, it will be a large lesion, a little bit large lesion in round in structure. Urticaria is not also in round. You can see in different photo itself, you can identify within urticaria and wheel. Isn't it or not? Okay, Ayurvedic terminology I will give. We can't give Ayurvedic terminology for all these things. I will show the cases at that time. I will tell. Okay. I'm not giving why because Ayurveda is not Ajari is not giving Ayurvedic terminology for all the skin diseases. You can see wheel here. It's an edematous, a little bit large plaque. Okay. Scale, you can see scaling will be there. That's the main thing. Like flakes, cornflakes, you are knowing. Flaking will be there. Crust, okay. Discoloration of the skin, we can see in eczema. Tomorrow, the next class, we will be having You can see urticaria and wheal. Here you can see or not. From the photo, it is identifiable, the same. Urticaria is not a simple lesion. It is not a type of basic classification of lesion. It is due to the exposure to some allergic agents. Basically, sometimes otherwise some insects, if they are crawling about your body, it will be making a lesion, which in the shape of a line or like that. It is called urticaria. Wheal will be a round, this one, edematous transitory plaque, which may last for a few hours and it will subside by its own somewhere. Clear? Fissure, you can see a typical cut. It is called crack or split. It is called fissure. Excoriation, something which is linear erosion. It is called a linear erosion. And you can see the normal erosion also. Lichenification. Okay, lichenification is thickening of skin. Scaling is scales. You can, whenever you are scratching it, scales will be coming. That's the difference between scale and lichen. And scar, I think you are knowing. And we are having black scars more in Indians. Okay, not red scars. Okay, thick permanent fibrotic changes. Clear or not? And sometimes some lesions, primary lesions, can be associated with or superimposed with other lesions also. I will show in my case itself. Clear or not? Morphology. I am not able to give the Ayurvedic terminology for all the skin diseases. Why? Because Acharya is not mentioning and I'm not classifying like that. Excoriation. Excoriation is a linear erosion. Erosion is loss of skin of a part. And when it is in a linear pattern, it is called excoriation. Linear erosion is called excoriation. And abrasion is something which is happening whenever you are having an exposure during accidents, you are having abrasion, your skin is losing. Here, it will be due to some skin disease itself, it is happening. It is called excoriation. There's a difference between excoriation and abrasion. Abrasion due to pressure. Whenever you are skidding out from the bike, it is happening. Abrasion is happening on your skin. Clear? So these will be interlinked also. Okay, crust with hyperkeratosis will be here. Clear or not? Next, we can move forward. Yes or no? Shape. How many of you are checking the shape? This one is very much important regarding skin disease. Okay. Are you knowing this? Or we can skip that point if you are knowing this. Yes or no? Shape. Okay. Linear. Okay, I will show the photo. Linear means in a line. Discoid means coin shape. Can you give an example of a discoid thing? Eczema, nummular eczema. We will see tomorrow. Okay. Annular means ring-shaped lesion. It is called annular. Targeted lesion means concentric rings are there. Concentric. Okay. Linear means it will be in a line. Okay, the through. Okay, we will tell. Discoid means it is a coin-shaped lesion. Annular means it is a ring-shaped lesion, like a ring. Target means so one or two, three concentric rings will be there. Polycyclic means interlocking. One or two rings which are interlocked. It is called polycyclic. Arcuate means in the form of a arc. Okay, serpiginous means linear relation which is having wavy shape. Whorled means development of lines that demonstrate a curved or spiral pattern. Digitate means in the form of shape of fingers. And zoster herpes zoster lesions you are knowing in the same shape. You can see the linear lesion. Please see that. Okay, linear lesion, it is in line. Okay, annular lesion, which is in the form of a ring. Serpiginous line, which is like a wave in shape. Okay, linear lesion and serpiginous lesion, there is a little bit different. Linear, it is in line. Serpiginous, the same line, but it in a wavy pattern. And whorled. Okay, whorled means curved or spiral pattern. It is called whorled. All the other thing, annular, ring shape, you are knowing that. And interlocking rings, it is called polycyclic. So many concentric rings are it is called targeted lesion like that. Clear? And you're getting this point. Shape. So you want to identify like this. A discoid, okay, macule lesion like that you want to answer. Clear? Yeah, serpiginous is somewhat snake-like. That's why it is called serpiginous. I think you are getting that answer. Okay, like a moving wavy one, which is in the form of waves. Correct. Distribution. Next, in which area it is this? Okay, it is very much important to identify whether it is discrete lesion. Discrete lesions. What is discrete lesions? herpes zoster. You are knowing the herpes zoster. I will give this photo after this class. Discrete lesions means localized area are called grouped, and multiple lesions or a wide area are called scattered. If some 3 or 4 lesions are there, which is seen only in axilla, it is called grouped lesion. Okay, and some lesions which is seen all over the body, it is called scattered. You want to tell discrete, okay, lesions, not pinpoint. What is the problem? You can ask which question. Regarding this shape or distribution. In which area you are having doubt? Yeah.
Dr. Sriya, you can comment your doubt, post your doubt. Okay, okay.
Discrete meaning you was saying, sir. Okay, no problem. No problem. Distribution. Distribution, sometimes it will be a single lesion. No problem. Okay, clear or not? Second one, grouped. For example, in axilla, you are having 4 or 5 lesions. Okay, in a localized area, only in axilla, it is called group lesion. You can identify a group lesion present in axilla like that. Whenever it is seen all over the body or a wide area of skin, it is called scattered. For example, in axilla, there are 3 or 4 lesions are seen together, or grouped. It is called a group. And over the back of your body, for example, over the scapula or over the axilla, not axilla, over the scapula, you can see somewhat some for 3 or 4 lesions, which are 3 or 4, 10 or 12 lesions, which are scattered, which are seen differently. Okay, it is called scattered. Clear. That's all. And sometimes it will be a single lesion also. Single or discrete lesion will be there. Next, sometimes widespread distribution will be there, and we will term it as exanthem. What is exanthem? Truncal eruption consisting of multiple symmetrical erythematous maculopapular. Macules and papules will be there, multiple in number, but symmetrical on both sides, which is erythematous. What is erythema? What is erythematous? What is the meaning of the word erythematous? Reddish. Okay, it will be a reddish covering will be there. It is called erythematous. Reddish covering means the outer lining will be red in color. Hence, it is called erythematous. Clear? Multiple symmetric erythematous macular papulation are called exanthem. It is according to dermatos. Okay. We can also measles, like it is called morbilliform. Okay, morbilliform lesions. In measles, it is morbilliform lesions, and in scarlet fever, it is scarlatiform lesions. You can tell like that. What is confluent? Individual lesions to form a large area of involvement. For example, a big lesion. Okay, big lesion which appear in a very large area. Confluent lesion. Okay, erythroderma, more than 90% of the body surface area. It is called erythroderma. This is the distribution. You can also tell on the base of distribution. First of all, it is the shape of the lesion. First of all, it is the type of lesion, then shape of lesion, distribution of lesion. You are getting or not? And also, according to region, you can tell. Centrifugal. What is centrifugal? Mostly affecting the extremities. It is called centrifugal. Centripetal, it is mostly affecting the trunk. Centrifacial, mostly affecting the forehead, nose, and chin. And the face, it is called centrifacial. Centrifugal on the extremities, centripetal on the trunk, centrifacial on the face, palmoplantar, affecting the palms and soles. You're getting an idea? Away from the center. That's the meaning. The correct meaning is this. Mostly affecting extremities. Centrifugal, the word meaning away from the center. But easy. If you are seeing the relations on extremities only, you can write it centrifugal. That's all. Whenever it is affecting, mostly affecting, okay, not absent, mostly affecting the trunk, you can write it as centripetal. Centrifacial, mostly affecting the face. Palmoplantar, mostly affecting the palms and soles. Flexural, mostly affecting the flexor surfaces of the skin. Extensor surface, you are knowing that plaque psoriasis is the best example. Extensor surface of the skin. Dermatomal, affecting one or more dermatomes, like herpes zoster. Periorbital, around the eyes. Perioral, around the mouth. Okay. Light exposed, involving the skin exposed to sunlight. For example, face, hands, like that area. Also, you can also explain like that. Clear or not? And you can also explain whether it is flesh colored, whether hyperpigmentation or hypopigmentation, characterized by redness, erythema, purpura. Purpura means dark cutaneous redness lesions. Okay, dark cutaneous lesions. Clear or not this portion? Then we can move forward. And we will show the case directly. I will share this PPT. Okay. So, we want to check all these things: history of the present skin condition, general health, past history of skin diseases, any general medical history, family history of skin disorders, other medical disorders, social occupational history, any drugs used. It's very much important in skin condition and other diseases. Can you name an Ayurvedic drug which is affecting the skin? Can you give some examples of Ayurvedic drugs that are affecting your skin? Ayurveda Shuddha hai. Kuch problem. Ayurveda is very Shuddha. There are no complications. Isn't it or not? Balladaga. Okay. I want a medicine, a formulation. I have cases itself. Kaishora Gugulu itself is sometimes problematic for skin disease. Pitta Prakriti, patients having Pitta Prakriti. Clear? Yes, Gugulu Diktaga. What is importance of Gugulu Diktaga? Arishta, you want to check whether that patient is Pitta Prakriti or not. Okay. Can we move forward? Okay. So you want to check it now. Okay. History of present condition, duration, site, spread, itch, burning, pain, whether it is increasing or aggravating or not, bleeding or not. Okay. Fever is there or not. What is importance of fever in skin condition? Importance of fever. Either it will be chickenpox, either it will be measles, either it will be dengue. Okay. What is dengue in Ayurveda? What is dengue fever in Ayurveda? Anyone? Typhoid. Okay. In Ayurveda, Vishamajjara, Dandagajara. I'm not getting the correct answer. No, no, no. Yes, no. Raktakatavada, no. Sandhajara, no. How many of you studied Raktapitta Jara? How many of you studied Raktapitta? What is Raktapitta? What is Raktapitta? You have studied Raktapitta. It is coming after Jara in the chapter, and it is mentioning that Raktapitta is due to Joranubandha Raktapitta. Raktapitta is a complication of Jara itself. It is mentioning in the chapter like that. Is it or not? And please check it. How a Ajari is telling a disease which is very rare. How many of you have seen bleeding disorder in your life other than dengue? I have not seen a case other than dengue. How many of you have seen bleeding disorder in your life? Yes or no? Please tell yes or no. Other than dengue, how many of you have seen bleeding disorders in your life? Other than dengue. Hemorrhagic patches due to typhoid. Okay. Other than dengue. No. How an Acharya can write a disease which is very uncommon? Acharya is mentioning Rektapitta, nothing other than dengue hemorrhagic fever, which is the last stage of dengue. That's why he is telling Joranubandha Rektapitta. It is mentioning typically in Madhavadana, you can check